This presentation is the first presentation in the infectious disease modules. It will provide you with some very basic principles of infectious disease. And I'm Bethany Von Hoff, and I will be the presenter today. We will focus on some of the core concepts relating to infectious disease, including basic strategies to prevent the spread of infectious disease, strategies for drug treatment, and ways to prevent drug resistance. Diseases can be caused by several different organisms. In this class, we will focus mostly on bacteria, viruses, which we will cover in the vaccine presentation, and fungi. But diseases can also be caused by helminths, such as hookworms, and protozoa. Before we go any further, we should make sure that we are familiar with and using the same terminology for infectious disease. An infection means that there's been an invasion and multiplication of microorganisms within the tissue, and also that an illness is present. In colonization, you can have the presence of bacteria, but there is no illness. You'll hear this often when they talk about healthcare workers' nasal passages being colonized with MRSA. This means that if you swab their nose, you'd find the presence of the bacteria called MRSA, but this is not causing any illness. Finally, there's also the term normal flora. This means the microorganisms that are normally found in the human body. You hear this a lot when people talk about the bacteria that are normally found in your gut or the gut bacteria. Infectious agents can be spread in a variety of ways. They can be spread through direct contact, such as shaking hands and then touching your face, or from mother to baby in birth, or through indirect contact, such as a contaminated door handle. There also can be vectors such as animals or food. For example, mosquito bites can transmit malaria, and hepatitis A can be transmitted through contaminated food. Finally, infectious agents can be spread through the air, through droplets or particles, such as through a sneeze. Prevention of infection is key to reducing the spread of disease. The best way to treat an infection is to prevent it in the first place. You can prevent infections through vaccines, which we will cover in a later presentation, through hand washing. This hygiene is a powerful way to prevent the spread of infection, especially in hospitals or other areas of patient contact, and self-isolation. It's often expected that you will show up to school or work even if you are sick, but it's really important that you stay home if you are sick so that you are not spreading illness to classmates or coworkers. You should avoid sharing personal items, and you should cook your food properly by cooking through to the right temperature, washing your hands as you cook, and by not cross-contaminating things such as raw meats and vegetables. In healthcare institutions, there are standard operating procedures to stop the spread of infectious conditions between patients and providers. There are 4 types of precautions based on the type of illness present or potentially present illness. Depending on the setting and institution, each type of precaution may require different levels of protection, such as simple alcohol-based sanitizer before entering the room, all the way to full gown and garb and respiratory mask before entering the room. The 4 types of precaution are standard, contact, droplet, and airborne. Signs of an infection will vary based on the severity of the infection, the organism causing the infection, and the location of the infection. For example, a child with a respiratory infection will show much different signs than a child with an ear infection. However, there are some general and broad signs of infection, such as fever, swelling, lethargy, warmth, redness, pain, nausea and vomiting, and an elevated white blood cell count. The goal of treating infections is to decrease the number of organisms present to the point where your body can overcome the infection on its own. You won't completely eradicate the organisms with drugs, but you can bring it to the point where your own body can handle eliminating it. What you treat the infection with depends on what the source of infection is. So if the source is a bacteria, you'll treat it with antibiotics. We won't really be covering antivirals in this course. This includes medications for HIV and AIDS. These medications are very complicated and are beyond the scope of this course. So when you think about selecting an antimicrobial, there are several things to consider. You want to think about what is the organism causing the infection and what agents are effective at killing this organism. This is also called sensitivity. For example, if an antibiotic is effective at killing a bacteria, then that bacteria is considered to be sensitive to that drug. You also need to consider the site of infection. Some medications are better at penetrating tissues than others. Some medications cannot get to certain areas of the body, such as the lungs. So even if the organism is sensitive to the drug, If it cannot get to the site of the infection, we would need to choose a different agent. Then there are also patient factors like pregnancy, because some drugs are not safe in pregnancy, or the liver or kidney function, depending on how the drug is metabolized and excreted. Age can also be a factor, as some medications are not appropriate for children. Also, you need to think about the safety and adverse effects of the medication, and some medications may have drug interactions or drug disease interactions that are not safe for the patient. Finally, you need to consider the cost and convenience. Even if the drug is effective, if the patient cannot afford it, we should not choose it. Also, some drugs need to be taken multiple times a day to work, so we need to make sure that the patient can follow that regimen before we recommend it. We risk treatment failure and bacterial resistance if they cannot take the medication as prescribed. Some other factors for selecting the right therapy include the spectrum, the sensitivity, and the resistance. Spectrum of activity means how many kinds of organisms an agent kills. Something that has a narrow spectrum will only be efficacious against a few organisms or a few kinds of organisms, whereas something with a broad spectrum, also called a big gun, may be effective against lots of different organisms. When you use a big gun or a broad spectrum agent too much, this can lead to antibiotic resistance, so we want to use a targeted approach or a narrow spectrum when possible. We want something that targets only the agent that's causing the infection. We also want to pick something that will eradicate the organism. As we talked about before, sensitivity means that the drug will be effective in killing the organism. We want to be sure that something is effective. We don't want to expose the bacteria to an agent that won't kill it, or to use something that is resistant to the medication. Resistance means that the organism is unaffected by the agent. So even though we want to use very narrow and sensitive agents, often when a person first presents with an infection, we don't know exactly what's causing it, so we treat it empirically. This means we are using our best judgment based on the symptoms and location of the infection and other factors, but we don't know what the causing organism is yet. This is one place where we would use a broader spectrum agent or a big gun that can kill many organisms. When we don't know what we're treating yet, we err on the side of caution and use something with a broad spectrum to make sure that the treatment we pick has activity against the organism. Then, we usually wait for lab results to tell us what the organism is. Once we know what the organism is, we can change the therapy to treat something more targeted so that we know that the organism is sensitive to that narrow spectrum agent. Sometimes we need to use more than one agent to treat an infection if it's a complicated infection or if the patient has other conditions. For example, a patient with diabetes with a foot infection, also known as a diabetic foot ulcer, these infections tend to have a lot of different organisms in the infection, and they are harder to target because the patients have poor circulation and low blood flow, so it's hard to get the antibiotics to the source of infection. With the foot ulcer, there's also a risk of patient losing the limb to amputation, so we think more about the severe outcome, so we are aggressive and may treat with multiple agents right away. Also, using antibiotics as prophylaxis means treating before there's an infection to help prevent an infection. For example, if a patient is having surgery, they will often be given an antibiotic before the procedure because we are putting them at risk for an infection when we cut them open. Depending on the surgery and the risk, we will be more or less aggressive. Antimicrobial resistance is a very serious and growing threat. Microbes are changing and eliminating or reducing the effectiveness of agents to cure or prevent infections. We are now finding microbes in patients that are not responding to antibiotics that used to be effective in eliminating the infection. This leaves patients with no options to treat the infection. This makes it more difficult and expensive to treat the resistant bacteria. To help with antimicrobial resistance, we need to use anti-infectious agents only when absolutely necessary. We shouldn't be using antibiotics to treat a cold or a viral infection that will not be helped by antibiotics. Finally, we want to use the most narrow spectrum possible. We want to save the broad spectrum agents for when we need to. There's no need to use fancy new drugs if the older antibiotics are effective and the organisms are still sensitive to them. Finally, it's important that patients take the antimicrobials as they are directed to. This means finishing the full course of antibiotics and taking them as prescribed. Not doing so can increase the risk of resistance. Finally, protect yourself from infection in the first place. This means washing your hands, staying home when you're sick, preventing the spread of infection, and staying rested and well hydrated. In summary, preventing the spread of infection and resistance of anti-infective agents is a goal we all share. We are all at risk of coming into contact with an agent that cannot be treated. We are all responsible for helping to minimize the spread of disease and the spread of antimicrobial resistance.